My name's Travis Neal. I work for Axonics in our field marketing department, and we put on events like this across the country. Today, Alex Hughes is going to be talking about incontinence, both fecal, urinary incontinence, and the treatment options available, both for stress urinary incontinence and for overactive bladder, and we'll get into all that throughout the duration of the webinar. First place we want to start with anything like this is these slides contain the important safety information for the products. So we're going to originally discuss stress urinary incontinence and Bulkamid in particular. And as with all medical procedures, there are some risks. So please visit Axonics' website for more information. And remember to bring all those important questions to your appointment with your provider when appropriate. Without further ado, Alex, floor is yours. You can take over with the quick bio, and then we'll jump into the content.
Awesome. Thank you so much. Like he was saying, my name is Alex Hughes. I have been a nurse practitioner for about 4 years, practicing primarily in urology. Urology was my first nurse practitioner job. The bulk of my medicine career was paramedicine and ICU nursing. I've been practicing with Dr. Shaw since 2020. So without further ado, I'll get you started, and we'll start talking about stress urinary incontinence and Bulkamid. We all have a bladder, and bladder symptoms can disrupt all parts of our life. And this is a really good slide I like to talk to, and I talk to my patients about, because this talks about the impact that it happens throughout everyday life. A lot of times, so you can see this first picture, the gentleman in the car constantly having to stop on road trips. So lots of times I'll ask my patients, as we get older in life, and then if they're starting to want to stay home from road trips, because they're the ones that are always saying, please pull over, I need to go to the bathroom, whether urinary or stool to do those trips. But urinary frequency is the primary culprit on that. So Axonics can help with that. In the second picture, we have everyone watching the movie theater. And this is kind of mine where it's like we can't last all the way to the end of the movie. So you have to get up and go to the bathroom. So these are all signs and symptoms of overactive bladder. And then this last picture, need a bathroom near where you work so you won't make it. So that's called urgency incontinence. So all of these things can affect quality of life, and we have devices and treatment options to help that. Your condition is not a normal part of getting older. Your condition is not just part of being a woman or an issue with prostate or caused by something you did. This is one of the most common things that I have to tell my patients for. They'll come in, they'll be 60 years of age or even younger, and they'll just say, oh, it's just part of normal everyday life. Of course I leak a little bit of urine. That is false. We don't have to leak urine. You don't have to wear a panty liner or a pad, because that's just part of the normal aging process. It does happen. It is much more common as we get older, but there are things that can cause those leaks to not happen at all. And then with issues with the prostate for my male guys, we also have treatment options for that as well. Your condition impacts your quality of life. The physical portion of it, limited participation in physical activities. The number one thing that I think about this is, exercise, yoga, those kinds of things. A lot of my female patients will stop going to those outings because they start leaking urine from stress urinary incontinence, especially whenever you do deep squats or things like that. Reduce social interactions, alter travel plans, exactly what we talked about on one of those first slides. So those road trips, you're choosing not to go on them because you feel like your symptoms are a nuisance. So you don't want to do that. So it kind of keeps you at home. Psychological, guilt, depression, loss of self-respect. Once we start, wearing Depends and things like that, that does start to affect our mental aspect as well. Avoiding sexual contact and intimacy. A lot of times in my appointments, leaking urine during sexual intercourse can be part of stress urinary incontinence. And a lot of times my female patients will stop wanting to have sexual intercourse due to the leaking urine. Occupational, absence from work, decreased productivity, going to the bathroom all the time, worrying about those things can affect work. And domestic, wearing pads and diapers, bedding, precautions and clothes. I think that's pretty self-explanatory. You are not alone. That's my kind of biggest thing I try to get out to my patients is this is just not talked enough, and 30 million women suffer from stress urinary incontinence. So you are not alone. It's just not talked about. Stress urinary incontinence is a common condition that affects 1 in 3 women at some point in their lives. This is an extremely common condition that is extremely undertreated. And there are simple procedures, which we will get into. There are surgery procedures that also can fix this, but one of the simple procedures that we like to talk about is Bulkamid, which we'll get into with one of the next slides. Understanding your condition. So what is stress urinary incontinence? So this is a really good slide talking about the female anatomy. I know it's female because there's no prostate sitting around that urethra. But this is normal bladder function. So you can see that the bladder fills with urine and then the urethra is closed here. So those are strong muscles. As we get older and as we have children and things like that, those muscles become weaker and weaker. So they have a hard time holding back urine. So you can see the urethra closed, the urethra open on this slide. That's what it's saying. And as we get older, unless we do our Kegel exercises, which female patients know about those to the T, my male patients are like, what is a Kegel? But Kegel exercises are what strengthen those muscles and can help with that stress urinary incontinence. Physical activity such as coughing, sneezing, exercise, anything that increases that intra-abdominal pressure can leak that urine. So just a strong sneeze or anything like whenever you have allergies out here in Austin, whenever you have those sneeze attacks is when the urine comes in and starts leaking. Muscles around the urethra contract, keep the urethra closed, and then stress urinary incontinence occurs when the muscles around the urethra are weakened, resulting in leakage of urine when physical activity increases the abdominal pressure. So good news, there are treatments for women that can help. Treatment options for stress urinary incontinence, okay? Your journey to find the treatment solution that works for you. So this triangle is, is a really, really good visual. Pelvic floor exercises is a huge, huge, huge underutilized part of therapy that I do utilize a lot. There are specially trained pelvic floor physical therapists. So the same reason if you go and hurt your shoulder and you go to the ER and the ER physician says, okay, we need to have surgery on the shoulder. And you say, I'm not sure I want to have surgery. What are the other options? Physical therapy is an option. So you can start to regain that muscle tone and the flexibility here in the arm using physical therapy. The pelvic floor is made up of tons of muscles and tendons, and it also gets loose or relaxed, just like we talked about in the last slide. So a pelvic floor physical therapist can help strengthen those muscles. I know it's Kegels, 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 but this is Kegels times 10. And it's a really, really good therapy that can help, regain some continence. The bottom right is the surgical sling. This is an actual surgery where they actually will go in under general anesthesia and lift up the urethra so that you're urinating over a mound. It is gold standard. It's been around for a very long time. And this is the urethral bulking's competitor. The urethral bulking, which is Bulkamid, which is what Axonics' product, which I'm talking about today, is actually injected into the urethra. So there's no cuts, no mesh or anything like that placed. And it actually bulk ups the urethra and closes it off so there's no stress urinary incontinence. Pelvic floor physical therapy. So these are the pelvic floor exercises. Anyone and everyone can do this. I even tell my patients do a quick Google search on pelvic floor exercises to strengthen the pelvic floor. Now, there are pelvic floor exercises to weaken or to relax the pelvic floor, and that's something that you do not want to do if we're trying to tackle stress urinary incontinence. So lifestyle changes, there are lifestyle changes you can embrace to reduce symptoms, maintain your weight in a normal range and lose weight if you are overweight. So any extra weight on top of the ureteral orifices, so abdominal weight, will put more pressure on the ureteral orifice and release urine. So weight reduction is extremely important. Quit smoking and control any chronic cough. Pretty self-explanatory. If you are coughing due to emphysema or COPD or things like that, and you're leaking urine from there, decreasing the actual tobacco or whatever it is that is making you cough can help with that. And then pelvic floor exercises. Pelvic floor exercises or Kegels can help improve symptoms by strengthening the pelvic floor with or without a pelvic floor physical therapist. Like I said, lots of times, there's YouTube out there that can help, but it would be pelvic floor exercises to strengthen the pelvic floor, not to relax. So this is one of the surgeries I talked about just in the previous slide. So this is a surgical sling, the mesh sling. And as you can see, this is obviously with all the tissue cut away, but that is the urethra coming out of the female. That silver mesh is placed underneath the urethra, and then it is cinched tight so that you are now peeing over a hill. That is the way that the slings work. Outpatient procedure, 80 to 90% success with a 17-year follow-up. Still considered gold standard. Women who plan to get pregnant may want to wait until after their last pregnancy to have the surgery, because obviously pregnancy can, release the mesh and then release the tension that's holding it up. The urethral bulking agents, this is the product that we're talking about today. As you can see, this is the female anatomy. Again, no prostate around the urethra. You can see the bladder that empties out into the urethra. That is the vagina, and then the colon behind it. And the blue the blue circles is where the actual agent is injected. The way that I describe it to my patients is, nowadays, you can see all sorts of men and women with giant lips. It's called lip injections. They get lip fillers. So that cosmetic process is almost the same as the fillers that we place in the urethra. So the urethral bulking agents such as Bulkamid are injected into the wall of the urethra in order to bulk it up and to prevent leaks. The procedure usually takes place in an outpatient setting. You'll normally be able to go home the same day, which is accurate for our practice. The procedure is low risk and allows you to continue to be active immediately following the procedure. That's one thing that's great about this procedure is there's almost no downtime. I do tell my patients they will feel like they have like a UTI around their urethra or urethral, like a dysuria, painful urination for about 48 hours, literally from the actual injection. So the trauma from the urethra is that's what that pain has caused. It's not a UTI. All right. What is Bulkamid? Bulkamid is a minimally invasive non-mesh alternative to treat stress urinary incontinence. Bulkamid is a soft water-based gel that is clinically proven to help improve and cure stress incontinence.
Bulkamid can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
So that was quick, but it kind of explains how the product is actually placed and literally what it's doing. It is literally creating a barrier out of your bladder. So we have a bladder outlet and a bladder sphincter that will close. And sometimes as we get older, it gets weak. So it just needs more bulking to actually close appropriately. And that's what this procedure is doing. Bulkamid is implanted to help cushion the urethra and restore a proper seal, assisting the natural closing mechanism of the urethral sphincter. Similar to the facial filler, which we talked about with the lip injections, it remains in the body over time without causing an adverse reaction to the surrounding tissue. What you need to know, what you could take home from this, 92% safe and effective. 92% of women reported being cured or improved following treatment with Bulkamid. It is a simple procedure. The procedure is a series of 3 to 4 small injections. It takes around 10 to 15 minutes in the outpatient setting. And long-lasting relief. Bulkamid is clinically proven to deliver symptom relief out to 7 years. We've done this procedure a lot for our patients. We've had a lot of success with it. And I can attest to everything it says. It's about a 10 to 15 minute procedure. It takes more to get to the surgical setting, more time to get to the surgical setting than the actual procedure itself. Almost always, there's never a catheter. I think maybe one patient where we've had a catheter that's been in place for about 24 hours after the procedure, just due to some anesthesia, not getting out of her system in time. But it's been a very, very, very successful procedure that our clinic has taken on.
Thank you, Alex, for going through the Bulkamid portion of this. We're going to switch gears and talk about Axonics therapy. Again, with this one, these slides contain important safety information for the products. As with all medical procedures, there are some risks. Please visit Axonics' website for more information. And remember to bring all of those important questions with you to your next appointment with your provider. Without further ado, Alex, I'll turn it back to you to talk about Axonics therapy.
All right, thank you so much. Axonics therapy is sacral nerve modulation. It's another term for a bladder stimulator. This is a treatment for overactive bladder. So if we go back to one of our first slides, where it was the gentleman in the car and saying, "Hey, I have to go to the bathroom. I have to go to the bathroom." That's for these patients. I also say it's my bathroom hunter patients, and you kind of know these people. It's whenever you go to a new store or a new restaurant, the first thing that you're looking for is a bathroom, and they need to know where it's at. Those are my bathroom hunters. So overactive bladder is urinary frequency and urgency, absent of urinary tract infections. So, these patients are the ones that are going to urinate every hour and a half, every 2 hours on the dot. Sometimes it can lighten up in the nighttime, so no nocturia, but even that, patients can have 3 and 4 times. Primarily affecting females. My male patients, whenever we have urinary frequency and urgency with them, typically it's related to the prostate. So, but Axonics therapy has also helped my male patients with overactive bladder too. We've done lots of therapies. I do all the trials in our clinic, which we will go into depth about. But the great thing about this product is you get to try it before you buy it. So it's like test driving a car. And I'll go into the trial, I'll go into the whole process, and this is Axonics therapy. Overactive bladder is a common condition that affects an estimated 50 million people in the United States. An additional 19 million suffer from fecal incontinence. And yes, so fecal incontinence is also a huge problem in America and other places, but we'll stick to America for right now. And this can be any involuntary loss of stool, okay? This could be, a complete loss of a bowel movement. It could be when you're urinating, some comes out. All of that, all of those nerves that control the rectal sphincter and the bladder sphincter are all coupled together, and we all treat that with the Axonics therapy. Your symptoms may be caused by the following conditions: overactive bladder, sudden urges to urinate and unable to hold it or control it, urinary retention, difficulty urinating and incomplete bladder emptying, and then fecal incontinence. All 3 of these conditions, and overactive bladder is a bunch of those symptoms, the Axonics device treats. Normal bladder function. So normal bladder function requires storage and emptying of urine. So the bladder is really supposed to be just a container for your urine. That's really all it's supposed to do. And it is a muscle just like our heart. So it can squeeze, but its natural form is supposed to be working under low pressure. So the bladder relaxes, the urethra contracts, you're able to urinate. So that's the normal emptying of urine. What is overactive bladder? Overactive bladder, or OAB, the cool guys call it, is the frequent and urgent need to empty your bladder. OAB often results in an unintentional urine loss. So urinary frequency, urinating usually 8 or more times in a day. Urinary urgency, feeling the sudden urge to urinate, like, oh my gosh, I can't make it to the bathroom. Urge incontinence, involuntary loss of urine, so just sitting there and all of a sudden it comes out, and nocturia, awakening 2 or more times in the middle of the night. We have bladder symptom questionnaires also that we give out to our patients. So if I have a female patient that's complaining of chronic UTIs, I'm usually giving them a BSQ, which is a bladder symptom questionnaire. And then having that's how we will kind of regulate and see how bad their symptoms are. It's a symptom score from about 0 to 35 or so. And if we do any kind of treatments, we'll score them pre-treatment and then post-treatment and see how well the device helped. What is fecal incontinence? Fecal incontinence is the uncontrollable loss of stool, solid, liquid, or mucus. Symptoms include urge incontinence, passive of incontinence and soiling. So fecal urgency, sudden urges to pass stool, urgency fecal incontinence, and an inability to stop the urge to pass stool, passive fecal incontinence, leakage of stool without activity or without awareness. Normal bowel function. As the rectum fills, it stretches the receptors in the wall of the colon and they're activated. Nerve signals are sent to the brain, making you feel the need to empty your bowels. To defecate, nerve signals coordinate with the relaxation of the pelvic floor muscles. We talked about pelvic floor physical therapy a lot, so this is also part of it. My patients that have chronic constipation or anything like that, I also like pelvic floor physical therapy for. Relaxation of the pelvic floor muscles, and the muscles in the rectum push the stool out. Good news, there are treatments to help regain control of your bladder and bowel. The patient care pathway, your journey to find the treatment solution that works for you. So this is all about the overactive bladder, urinary retention, and fecal incontinence. Usually starts with some kind of consult with your doctor, either a primary care physician or a urologist like us. And with your primary care physician, you'll talk to them about, losing control of the urine or urinary frequency going all the time, or fecal incontinence, and they can start the referral process. Or obviously, if you're seeing us, then we'll just start the process. We'll initial treatment, and then follow up with your doctor and advanced therapies. So lots of times we'll either try pelvic floor physical therapy in the beginning, we'll try some medicines, or we'll do some cystoscopies to look at things. And then once we hit third line therapies, which is what Axonics and Bulkamid are, that's when those therapies come in. Did you know that 80% of people with overactive bladder discontinue their incontinence medications within 1 year? The primary reason for that is the two classes of medicines out there. One has terrible side effects. Usually it's constipation, dry eyes, dry mouth, dry vagina. So a lot of times my patients will not adhere to those medications because those side effects, they're not very fun. And actually the symptoms that they're treating with the medicines are better than that, so they just don't do the medicines. The other medicines are very expensive. They're newer into the marketplace. And what we've shown is, the third line therapies, the actual procedures that we offer, do better than the medicines anyway. So I'm not too surprised by that metric. Initial treatment, overactive bladder, like we talked about, bladder training exercises, lifestyle changes, urinary retention, behavioral management. There's some medicines that we can try out there, and fecal incontinence. Same thing, dietary changes, bulk up the fiber and all those kinds of things. Sphincter and pelvic floor exercises. You can see pelvic floor exercises are across the board here. Third line therapies for overactive bladder is sacral neuromodulation. That's the Axonics device. Urinary retention, same thing, and then fecal incontinence as well. So you can see that all three of these things, there's a bunch of different meds you can try for each one of those symptoms, but the Axonics device treats all three. This is another therapy that we actually don't do in our practice. I just went to a huge conference where they do this therapy. It's called PTNS. So there is a nerve that runs along your ankle all the way to the bladder. Same kind of concept with the needle therapy. Sorry, I'm drawing a blank here, but that kind of therapy, same kind of concept. But we have not been doing it. That's PTNS delivers electrical stimulation through a needle placed above your ankle. It's an in-office treatment, 12 weekly sessions for about 30 minutes each. Responses usually within 5 to 6 sessions. And if symptoms improve after 12 sessions, then you do maintenance, 1 session per month for years. Botox, we do offer this in our practice. The big problem with it is you have to repeat it over and over again. So this is done through cystoscopy, where I'll actually do a cystoscopy and inject the bladder with Botox. It's for overactive bladder, but again, it does need to be done every 6 to 9 months. So you're having to come in, do cystoscopies, and do the bladder and do the workup. It is successful, but it is something that you have to repeat. So its big competitor is the Axonics device, the sacral nerve modulation. Sacral nerve modulation, that's the device that we have been talking about. So this graphic can kind of walk you through what it looks like, where the sacral nerves are. So sacral nerve modulates the activity of the sacral nerve, helping restore bladder or bowel control. The therapy can be trialed in a simple office procedure, is what I was talking about. That's what I do in our clinic. After a successful trial, most people choose to get long-term solution, which includes a small discrete implant. The great thing about my selection process is I have about an 80% turnover rate, meaning my patient selection is very specific. And about 80% of my patients that I do a trial on will turn over and get the implant. It is that successful. The in-office trial is usually about 10 to 20 minutes, just kind of depending on the anatomy. I use lidocaine, numb up the low part of the back into the sacrum, and we place temporary leads down into the sacral nerve bundle, and then we actually turn on the device while you're awake. Not trying to scare anyone, but if there's those surgeries where they actually will do brain surgeries while they're playing the guitar, and then they are trying to work on a specific part of the brain. Kind of same concept, except for I'm not cutting open your head, but I'm looking for my patients to tell me if they feel a stimulus between their rectum, on their buttocks, those kinds of things. So my patients are the ones that are telling me I'm in the right place, and then I drop the leads, and then the trial commences. Axonics is a fantastic company. They are very, very good at keeping up with their patients. So every day after I do a trial, they are checking in with their patients and doing their own scoring symptoms on how often are you getting up, how often are you leaking, etc. So by the time the lead pool comes about 3 to 5 days afterwards, we already know if they're going to get the implant. And usually the patient is chomping at the bit to get the implant because they're the driving force. And if their symptoms are not relieved, then they're not going to go for the implant. So just to kind of recap, what is Axonics therapy? Sacral neuromodulation therapy is a guideline recommended therapy that restores normal control of the bladder and bowel. The way that I describe it to my patients is if you do Botox, so you have a bladder here and I'm doing Botox, I'm treating the actual muscle of the Botox. I'm not treating the problem. It's like, getting an ibuprofen for a hurt knee. You're relieving the pain, but you're not relieving the actual issue of the inflammatory response. When you go and do sacral nerve modulation, you're remapping the nerves that control the bladder. The other way I describe it is if you have an electrician and you have a light out, but there's something wrong with the actual port, you can change the light bulb all day and it's not going to come on. You got to look at the electrical impulse that's causing the light to go out. And that's where sacral nerve modulation comes into play. The other way that I describe it is a pacemaker for the heart. A pacemaker keeps the heart beating at a specific rate and rhythm, and that's what it does and keeps that organ going. The same thing can be going on with the bladder. So this bladder stimulator will remap your normal bladder function and get you going back to what you were used to when, 20 to 30 years ago. How does Axonics therapy work? Overactive bladder, fecal incontinence, and urinary retention may be part of abnormal communication between the brain and the bladder and the bowel. So the Axonics therapy provides gentle stimulation to the nerves that control the bladder and bowel. The stimulation can help restore normal communication between the brain and the bladder and bowel, which can result in an improvement in your symptoms. The first step towards long-term therapy, if it is determined that Axonics therapy is right for you, you'll first try the therapy for the trial period firsthand. And if you experience satisfactory reduction of your symptoms, this is the trial that I talked about. Simple test is minimally invasive. That can be done in the office. Ours are all done in the office. The doctor will insert a thin wire called a lead near the nerves, go home, resume most of your regular activities. During your trial, you can adjust your therapy with an easy-to-use remote. And this bottom picture of this, Jill, she's holding the remote that actually controls the device. Kind of like to joke that you have like a remote control or a garage door for your bladder. Now, common misconception is if you have to turn that on to pee. No, that's not what it does. It just remaps the configuration of the nerve, so it's not firing on all cylinders. So you can still pee normally. During your trial, you can adjust the therapy with an easy-to-use remote, track your symptoms to see if they improve, and discuss your symptom relief with the physician in the next steps. So there's two different devices out there. There's one that is rechargeable, meaning the one on the left, the R20, is a rechargeable device. You can't really tell in these pictures, but it's much smaller than the other device. Because it is rechargeable, it has a smaller battery. So if you're younger or have a very, very small body frame and you don't want the device visual, the smaller one is there for my patients. You do have to charge it about every 6 to 10 months, but it can last up to 20 years because you're recharging it. The F15 is the truly recharge-free device. You don't have to charge it at all, and it can last up to 10 to 20 years depending on your stimulus. Most of my patients, I think, go with the F15 more so than the R20, but having both devices available to you and you can choose is also a really good option. This is the remote. It is very easy to use. Most of my patients use it very well and don't have any problems with it. Patient remote control, pocket size, easy to use, easy, discrete way to monitor and adjust your therapies. And Axonics, the team, they have a patient contact line where you can call in. They all have access to your specific therapies and can remote help you with the remote as well too. Provide patient access to full body MRIs. That's also a big question I get is, hey, can I go through the airport line? Can I get an MRI? Those kinds of things. And these are approved for MRI. An implant does not need to be removed from the body for MRI scans if certain conditions are met. Approved for 1.5T and 3T full body scans. Meaningful and lasting improvement. 93% of patients achieve clinically significant improvements in incontinence symptoms at 2 years. This is a fantastic therapy for my patients. I think the biggest hurdle I get with them is the comfortability of having a device in your body. And when I meet my patients with that, because by the time I'm talking to them, it's either bladder Botox or sacral nerve modulations in terms of overactive bladder treatments. And the way that I talk to them is like, hey, you can do either. You know, I have tons of patients that do either. But the sacral nerve modulation, one, you can do the test. That's the worst part of it. You come in, you do a quick 15-minute test with me, and you do a trial for 3 to 5 days where, yes, I know you can't shower, which you can sponge bath, you can clean yourself off. But if you have big symptom relief from that trial, then you can make an informed decision. You can make an informed decision on, okay, hey, the device works for me, and I can go ahead and put the device in, and I have 10 to 15 years of symptom relief. Or you could always do the Botox route after that. And then there's always medicines and things, that you can try even before those or after those. But the Botox, I always tell my patients, if you do Botox first and you have a bad response from it, I have to wait at least 3 to 6 months before I can even do a trial on you, because you have to be symptomatic for the trial to even take place. I really, really, really like this device. I think it works well for my patients, and it saves a lot of unneeded more office visits, doing the med refills and repeat Botox, cystos, and things like that. 2 years after the implant, over 90% of patients were satisfied with their results. 94% of the patients are satisfied with Axonics therapy, and 93% would undergo the therapy again with the same expected results. That's pretty high up there. And look at her. She is so happy, and it's just fantastic to live a normal life. The implant procedure was much easier than what she thought. I really appreciate you having me and letting me talk about this. I do think that this is a very, very undertreated symptom tree of symptoms. Overactive bladder is one of those things where they're just like, oh, I'm getting older. This is just part of it. It's not true. And stress urinary incontinence, again, not true. It's not part of normal aging. There are therapies that can help. And these are minimally invasive, covered under your insurance providers. And if you feel like these symptoms are, affecting your quality of life, or even friends that you know, let them know. We'll gladly see them. We have telemedicine availability. We see patients Bastrop, Dripping Springs here in the heart of Austin, Liberty Hill, Georgetown. So if you know anybody, or if you want to come see us, please be happy to come see it.
At this point, that concludes our webinar. Let us know if you have any questions, but please reach out to Austin Urology Institute and schedule an appointment if you are in need. Thank you again for everyone for their time tonight.